This is Janice Lopez from the International Organization for Migration, and this is the Migration Health Research Podcast. As we bring the Migration Health Research Podcast to a close, I spoke with Dr. Kol Wickramage, IOM's Global Migration Health Research and Epidemiology Coordinator, about the vital role of knowledge repositories and science communication in the migration health research and data landscape. Let me dive into my first question, Kol. In the many years that you have served as Migration Health Global Research and Epidemiology Coordinator in IOM, how important knowledge repositories are in disseminating evidence. Please feel free to cite examples based on your vast experience on this front.
Well, thanks, Janice. A great question. I think since 2016, when we built the Migration Health Research Portal that basically houses a knowledge bank, a repository of all of the key technical scientific publications at the intersections of migration, health, and development that IOM has developed. One of the real impetuses for creating this knowledge bank is to ensure that there is a centralized, organized way of sharing research findings and data on migration and health so that it's available, to policymakers, to practitioners, and the public to supporting informed decision-making and effective responses to migration health. I mean, in a context that is highly polarized and politicized, data and evidence is absolutely key to guiding evidence-informed policies and practices. But knowledge repositories alone quite ineffective as a static sort of knowledge bank. It needs to be made dynamic in the way that we synthesize knowledge. So how, even with the best available data, how this can be translated to policies and practices really matters on how you communicate the science, communicate the evidence, present this in a form and format that is digestible to various audiences, be it policymaker, be it practitioner, be it an organization supporting government technical cooperation in migration health, for example. So I think one of the critical lessons is that even with the best available data, if you cannot communicate this in an effective way and it's accessible and digestible in an effective way, you're not going to have that translational value, the evidence to translational value to policy and practice. So one of the key things of any type of knowledge management repository is how you make this dynamic. And so one of the things that we did with the Migration Health Portal is that we introduced elements such as bulletins. This is where we have a synthesis of the evidence in a particular cohort, so every 3 months. And we highlight some of the key publications and findings of these scientific reports and technical reports. The other thing we did was, and this was the first for the UN Migration Agency, initiated a IOM Migration Health podcast where we interview the principal investigator or co-investigators involved in a study, where we pack the key findings, what this means practically in terms of policies and practices. So in making the evidence speak, in ensuring that science is communicated in a digestible way. And we're proud to announce that this was, the first and longest running podcast for the UN Migration Agency. We also have a repository that is searchable through multiple search strings and multiple search terms by region, by, for example, if you type in tuberculosis in the Asia Pacific region, a number of publications around this, and you can sort this by years, etc. So it's a sort of way in which knowledge and data is organized in order for the policymaker, the practitioner, the project developer to access that. I think knowledge repositories are absolutely critical, but they need to be made more appealing to the wider audience to ensure translation of evidence to policy. So this is why the podcast, the bulletin, and the portal itself is absolutely key. But of course, since 2016, when we initiated this, and it's been a 10-year genesis and run, we've actually sort of mapped out about 893 different scientific publications and articles. in 33 bulletins and 18 podcast episodes. And I think this is some of the ways in which knowledge management goes beyond static warehousing into more dynamic interfacing with policymakers and practitioners.
You mentioned science communication. What do you think is the role of science communication in reaching a wider set of audience, ensuring that evidence is translated into policies and programs?
Science communication, one of the key hallmarks is in generating debate, in generating discussion. And to generate that, we need to move beyond, as I said, a traditional form where you publish research in a peer-reviewed journal or a UN report, and it just sort of sits there. One of the ways in which you have meaningful engagement is by having these forums where you can discuss the research. Now, of course, one of the ways in which we have seen the portal really manifest in uptake is by looking at the metrics of user statistics. So, for example, since its inception, there has been around 1,200 active user engagements per month on the portal, about around 230 per week of active users engaging in the content, around 390,000 specific individual events of engagement. And so these metrics, around 1,200 people per month engaging individual active users, just shows how much the portal has in fact had some sort of reach in terms of the migration health data and research generation. Of course, there's other metrics like podcast on Spotify. So we used, Spotify as a platform to disseminate the podcast. And one of the important aspects is that there are different audiences that digest scientific data and information in different ways. I think COVID-19 taught us anything as public health practitioners and as public health experts is that we need to do a lot better at translating science and evidence to the general public and to the policymaker community in ways that are beyond the confines of a scientific paper. I think we need to do a lot better at translating science and evidence. And I think the portal, given its different ways in which it presents science, is actually a really crucial element of this type of user engagement statistics that we see. In fact, the portal gets more traffic, if I can say, than the other larger IOM portals when you look at just metrics alone. And I think, obviously what we can do better is actually to ensure the continuity of such important knowledge repositories, but also go beyond to actually generate content that can sort of curate some of that discussion and debate, right? So, for example, in a recent paper around COVID-19 outcomes, this is deaths, cases, hospitalizations, for example, on migrant and mobile populations globally. This was a global systematic review and meta-analysis. At the back of that podcast, one of the ways in which one can actually take this a step further, Janice, is to actually generate forums where people can come in and debate the science that was just discussed during the podcast. And I think this type of thing generates a lot more content, scientific discussion and content that can actually lead and catalyze to better approaches on ensuring health equity and inclusion, for example, in the case of COVID-19 and migrant and mobile populations. So there's, of course, a lot more that we can do in this resource-constrained environment. This is the challenge. But I think just looking at those statistics alone, 1,200 users per month, about 230 per week, you can start to see that even in this domain of global health, that is migrant health, migration and health, you can see the kind of attention, action that this type portal brings. And I think it needs to be absolutely critical that we continue such a dynamic knowledge management platforms.
As this is our last podcast episode, I think it would be apt to end with your reflections on our decade-long journey with the Migration Health Research Bulletin and podcast. The floor is yours, Col.
Well, thank you so much, Janice. And indeed, thank you for being such an amazing curator of the Migration Health podcast for the UN Migration Agency for over a decade. So it's amazing when we started this journey. Our goal was to provide this knowledge management repository, but also it to be actively reaching out and going out there through the portal, through the dynamic search pages, through the bulletin, through monthly network membership, etc. So it's really been an amazing journey over the last decade. And I think it is bittersweet that it has to come to a close due to resource limitations. But the good news is that, of course, all of the content, all of the podcasts, all of the technical documents and the referencing are still there for the world to access. I mean, it is an open source portal. And I think what users also may not know is the fact that we have an internal, inward-facing reference page for staff of the UN Migration Agency to actually support in terms of their technical work in migration health, data, science, and research. So that's also an in-house portal, if you will. So I think the legacy of the portal will be there for open source access and for people to really engage, be it a policymaker, a student, a practitioner, etc. So I'm happy and proud of the team's work for enabling this to happen. I think that the real important question is, how in this age and era of great polarization and fiscal tightening and reprioritization is science and evidence in this field of migration and health are going to be taken forward. And I think the portal is an example of a space where there really needs to be a sustained investment. Given the metrics, given the impact that you've seen or we've shared, I think it's quite critical that this type of knowledge management continues. But thank you again for our listeners. Thank you for our readers and our consumers of the portal. We hope that it will continue to serve as a unique reference point in migration health. Thank you.